Thank you very much, Madam Chair. I want to thank your staff for working with us on this bill, which really has to do with very important facilities in our communities. AB 220 would require a health facility that provides subacute care services to make sure that they are using a specific criteria and a specific way to be able to submit their billing with a treatment authorization request when seeking authorization for subacute care services. It would prohibit a Medi-Cal managed care plan from developing or using its own criteria to substantiate medical necessity for subacute care. This is a very niche type services that these folks provide. And so I would love to, with me today is Doug Padgett on behalf of Totally Kids Rehabilitation Hospital and Dr. Joseph DiCarlo with Children's Health of Northern California to really speak on the necessity of this bill and the great services they provide.
Nope,
There
we're
we
here.
Oh, here we go. Thank you, Dr. Jackson, Chair Bonta, Vice Chair Chan. Thank you, committee, for seeing us today. You're taking time to make sure that a mishap delaying care to these needy children gets fixed. This is something that worked, and then it didn't. I happen to be involved. Did I say who I was? Doug Padgett, Totally Kids, in helping create pediatric subacute for the state of California back in the early 90s, and helped to write the regs and the law that we've been working with for 30 years, and it worked. You would think that medically fragile children and creating medical necessity would be complicated, but it actually isn't. And it's in law, and it's in regulation, and we even created a form, the 6200 form, that just checks it off. If you have these needs, a ventilator, tracheostomy, needing suctioning every 6 hours, and other things. There's other things involved, but it's one page. And then you bring a few pieces of paper from the chart that backs it up, less than 10 pages, and you have 100% success. But as this whole program transitioned over to CalAIM managed care, the instructions and guidance that was merely guidance was not listened to. So the insurance companies, thinking we've got to redesign the wheel. Three things happened. I attend every meeting on Tuesdays on the admissions that come in. All of a sudden, delays. Children were being delayed coming in. Second thing happened, I reviewed the financial reports and found out that our receivables went up $1 million in 6 months. Then I walked by the copy machine as the case manager was copying 3 inches of paperwork to send when we used to use 10 pages. And this is all because the insurance companies, the MCPs, did not take the guidance. I was privileged I was brought with DHCS to help teach the insurance companies last October. Again, we gave guidance, but there was no accountability to those insurance companies. Now, I could mention Nevaeh and William and Nancy. Those aren't their real names. That I watched delayed 32 days, delayed 3 months, delayed 6 weeks, sitting in NICU, waiting to come to our pediatric subacute facility, all because the insurance companies didn't use the form. So we're asking you, please, just help us bring accountability in this one little area. There's 130 of us subacutes in the state, so it's not small. Our little facility saves the state of California $150 million a year. Thank you.
I'm Joseph DiCarlo. I'm the medical director at another subacute facility in Northern California. And subacute's an unusual segment, frequently misunderstood. It's for patients not sick enough to be in the hospital anymore, but too sick to be in a nursing home or at home. And I think the most important piece of that puzzle is that these people are already hospitalized. So a delay in their acceptance to a subacute isn't somebody coming from home. It's somebody being charged many more times that what would cost to be in our facility than ours. So being in that NICU, for instance, might cost $10,000 a day. And in the subacute, it's 1/7 of that or 1/10 of that. And so a delay in authorization actually is extremely expensive, usually for the state of California. So without a standard, with a clear standard, without a admission, gatekeeping can be interpreted in all sorts of ways, especially in children, because there are not that many of them, but they are extremely complex. So if in a given county, we'll have 0 or 1 or 2, 3 or kids in facilities, period. So they may not be faced with a patient like this for 6 months or a year, and then they have to review this extremely complex patient who's very different than last year's extremely complex patient. We had a very simple system, a one-page checklist, very easy to use. And Doug's in Southern California. In Northern California, most of the counties actually figured this out pretty quickly. One didn't, and it caused us the delays similar to what Doug has described. But as I said, a given county may have no patients for 2 years, and then the third year they have to relearn the whole process. We had it simple before. So standardization is the obvious solution. We did it before. We should be able to. I think we should have it mandated if possible, because it actually works, and we've proven that it works. It's humane for the patient, good for the family, and extremely cost efficient for the state.
Thank you. Are there any other Me Too's in support?
Kevin Guzman with the California Medical Association in support.
Yvonne Chung with the California Association of Health Facilities in support.
Good afternoon, Madam Chair and members. Connie Delgado on behalf of the District Hospital Leadership Forum in support.
Good afternoon, Dixie Samaniego on behalf of the California Alliance of Child and Family Services in support.
We are doing any witnesses in support. Any primary witnesses in opposition to the bill? Any Me Too's in opposition? Seeing none, I will bring it back to the committee for comment or question. Thank you, Assemblymember Krell, seconded by Sanchez. Assemblymember, you may close.
I ain't saying nothing else. I respectfully ask for an aye vote.
With that, we have a motion and a second. Secretary, please call the roll.
The motion is due pass to appropriations. Bonta.
Aye.
Bonta, aye. Chen. Aye. Chen, aye. Addis. Aguiar Curry. Rogers. Aye. Rogers, aye. Carrillo. Carrillo, aye. Flora. Gonzalez. Krell. Krell, aye. Patel. Patterson. Patterson, aye. Rodriguez. Sanchez. Sanchez, aye. Schiavo. Schiavo, aye. Sharp Collins. Stephanie. Stephanie, aye.
That measures out. Thank you.